Hello, my name's Dr. Marita Long and I'm one of the GPs working at Glebe Hill Family Practice. Today I'm going to be talking to you about contraception, and specifically I'm going to be talking to you about hormonal contraception, and in particular short-acting hormonal contraceptives. And they're really two types, so it's either going to be the pill, which will be a combined oral contraceptive pill like these, or potentially a progesterone-only pill, or the NuvaRing, which is a little ring that sits in your vagina that has estrogen and progesterone in it. So the combined hormonal contraceptive pill is, as I said, probably one of the most popular choices that women make. There are some really important contraindications to using the pill though, and that's why we always recommend when you're coming to talk to your GP about the pill that you do book a double appointment, because there's a lot of information that we need to get through in terms of your past medical history, your family medical history, and in terms of educating you about how the pill works, what the side effects are, and what to expect. So in terms of how does it work? Well, I always think of these as putting your ovaries to sleep. So that if your ovaries are asleep, what happens? They don't release an egg. If there's no egg, there can't be a baby. So that's its main mechanism of action. It also thins the lining of our uterus down, which means our periods tend to be less painful and less heavy, which is a great benefit of being on the pill. And the other thing it does is change the mucus in our cervix, which makes it more hostile to sperm. That means it's harder for the sperm to get through, swim up and meet the egg that shouldn't be there. So that's basically how it works. So because it has those mechanisms of action that we're seeing on our ovaries and uterus, there's potentially other effects that can happen throughout the rest of our body as well. Some of them are what we're looking for, so there'll be some pills that are really good for women with acne in terms of reducing the amount of acne, and there'll be some that are really good at being able to allow you to skip periods. For example, if you had a condition called endometriosis where your periods were really painful and really heavy, we can get great cycle control using the pill, which is terrific. The NuvaRing is a newer one on the market, which we don't use a lot of, but for some women who can't tolerate the pill orally, this is a slightly lower dose. It just sits in your vagina. There's no specific spot it has to be in, and we just have to take that out every 3 weeks to have our period and pop a new one in. So that's a great choice. One of the downsides to the NuvaRing is it can be a little bit more expensive than our friend the pill, which is actually super, super cheap. There are loads of pills on the market. We always recommend starting with the stock standard pill if you've got there's no safety issues around. And then if we need to target a more specific area of need, for example skin, we might move around to a different pill if needed. But most of the stock standard pills that I said are very, very cheap, easy to get your hands on, work really, really well for most things, for most women. When we start you on the pill, we would always make a time to get you back to follow up, because there are, as with any medications, potential side effects. We'll always spend the time educating about those potential side effects, and we'd invite you to come back sort of in the 2 to 3 month mark to just see how things are going. So just remember, if you're looking for contraception and you're thinking that the hormonal form of contraception is one that you'd like to use, book a double appointment and come and talk to us at Glebe Hill.